There are many similarities between aconite and belladonna in fever in cases of infant or very small children. The first similarity is that both medicines have sudden and acute onset of the fever. Both medicine will have causation as exposure to cold air. Both medicine will have burning heat. In both medicine, fever may be associated with convulsion. Both medicine will have no complaint prior to onset of fever. In both medicines, fever comes after evening, in night or midnight. But there are certain differences that help to select either belladonna or aconite. Aconite has a very violent exposure to cold. For example, if a child is carried in bike or scooty in winters, then the child may catch cold. Whereas belladonna has even mild exposure to cold. Aconite has burning heat all over the body in the fever, but belladonna will have burning heat all over the body except feet. Feet are cold in cases of belladonna. Aconite is more restless and belladonna is more delirious. The baby will be very restless in case of aconite, and in belladonna baby will spit, jump out of the bed, or if it is infant then it is often difficult to get the symptom. Aconite is thirsty and belladonna is thirstless, but it is difficult to interpret in case of infants up to 6 months of age. But some doctor consider if baby is taking milk regularly, they consider it as thirsty, and if baby has stopped taking milk, then they consider it as thirstless. But I don't know how far it is correct. I would like to give an example regarding history taking in cases of aconite and belladonna. If a child is having running nose or cough for 3 days, and in 4th day the child develops fever and comes to you, you will ask the parents about the duration of fever. But if you miss to ask about running nose, then whenever you will give aconite or belladonna, you will fail, because parents may or may not tell that child was having running nose also. They will simply tell that the baby is having fever for 1 day, and in rural India they do not consider running nose as any disease. So in that case, history taking is very important.